For patients with psychiatric conditions, coronavirus is a huge problem because of exacerbation of existing psychiatric conditions and also because of the change in lifestyle that comes with the coronavirus. For instance, people with depression are suffering a lot from isolation. They had difficulty before in connecting with other people, and now that is even more difficult than it used to be. So there are people that are developing more severe symptoms. There are people that don't have the type of access to mental health care that they used to have before, or there are people that are so worried about getting an illness that refuse to go in contact with their health care providers. So people with psychiatric illnesses many times are at much higher risk of paying huge consequences for these epidemics. There is a risk of suicide that is increased, and for sure there is a risk of a dramatic loss of quality of life. Again, it's important that we keep in contact with our patients, that we call them if we cannot see them. If possible, we should have video calls, so we should have telephone calls. It's important that we stay in contact with them because isolation is not what they need. We need to make sure that if they are receiving medication treatment, they continue receiving medication treatment, that they have a way to get their supply of medication. If they have poor adherence and they have illnesses like bipolar disorder or schizophrenia, we should consider using long-acting antipsychotics, long-acting medications. We should consider sending our nurses to their home in order to increase the likelihood that they receive the medication and provide them with all the help that we're able to give them. Once the epidemics will be less severe, many people will have to go back to their job, go back to their work, go back to the university, go back to their studies. And some people, including our patients, may be worried about this new change in lifestyle, about going back to the risk of getting a virus if we don't have the vaccine yet, about the consequences of not having been at work for so long, about their job being in jeopardy because of the economical crisis. And some of our people are already worried about the new change that will come when things get a little better. This is why it's very important that we continue treating our patients nowadays, but we also look at the future, because unfortunately this epidemic is having a huge impact now, but will continue having an impact on mental health for a relatively long period of time.